Ross here, back again for another chapter in our abnormal psychology for A2 level. We're going to be covering the anxiety disorders, right? So this is fairly straightforward, and many of you would probably be able to relate because we're going to be talking about phobias, and that's something that many people do have. Now, again, a reminder, you have to, when it comes to A2, psychology in Cambridge, you really need to read the actual studies which are used, and you should consult extra resources online to understand the studies better, to understand certain concepts better, because your textbooks and this YouTube video is not going to be enough, right? You need to be able to look for other sources as well. Firstly, I usually ask my students this question on Mentimeter. What makes you anxious? Think about that question. What makes you get anxious? Do you have any anxieties? Some people who are introverted, they get anxious when they are mixing around with a lot of people, right? In crowded places, people get anxious. I often get anxious when going on roller coasters, right? I always get a little bit anxious because I'm always worried about whether roller coasters are safe or not, right? Some of my friends, they love roller coasters, they're adrenaline junkies, but I really don't like them, right? So what makes you anxious? Okay, there is a video here about anxiety disorders, which I will not be showing, but you can go and find many videos about anxiety disorders online, which are really informative. Okay, let's talk about the characteristics of anxiety disorders, right? In your A2 level for abnormal psychology, it's always characteristics, causes, and treatments, right? So it's very easy if you break it up into three parts. Firstly, let's talk about the characteristics. So anxiety disorders are characterized by frequent and persistent worrying. Right now, it's normal to worry about small things on a day-to-day basis. For example, let's say you switched on the stove in your kitchen and then you forgot if you switched it on or not. Right, you have a slight worry, right? But if it's frequent and it continues to persist, even after you switched it off, but you still worry about it. You worry about it the whole day. You worry about lots of different things. And what the problem is, when you worry, you don't function as adequately as you should. On a day-to-day basis, right? It's also about perceiving threats. Now, there are legitimate threats in the world, right? If you're face-to-face with a great white shark, that is a threat, right? If you're swimming in the sea and a shark comes towards you, that's a threat, right? But perceived threat can be something, you see a little mouse and you jump on the table, right? That's a perceived, the mouse can't hurt you, right? A little ant can't hurt you, a small spider, house spider can't hurt you, right? But sometimes people perceive threats to be way out of proportion, right? So it depends on a perceived threat or what threats you happen to perceive. But in actual fact, as I said earlier, it might be minor or non-existent, right? You might think it's a threat, but actually, realistically speaking, it's quite non-existent. It's not really a threat, right? A small little spider, small little mouse, not going to kill you, right? But a shark, yes. So it's often a disproportionate type of anxiety, but people often who suffer from this, they don't realize it. They think they're reacting normally, right? Oh my gosh, it's a little spider, and they jump and they scream and they run, right? And some people, we often accept that as it is, But it can be when it becomes disproportionate, when it's like a way over the top reaction, that becomes a problem, right? More of a disorder. Right? A common feature is a panic attack, right? So a panic attack is what happens to you, right? When people really, you can barely even breathe properly when you're going through a panic attack, right? Your whole body seizes up and your whole body is like in a panic attack. And we'll look at some of the symptoms of that in a moment. And so that's what can happen when you reach a certain threshold of incredible anxiety and fear. Yeah? So it's also this feeling of restlessness, can't sit still, muscle tension, that's very common, right? Especially in a panic attack. Difficulty to concentrate because you're constantly worrying about stuff. You're very tired, right? Worrying can be very tiring. Constantly thinking about things, always feeling tired, very irritable, right? If anybody says anything, does something that's not according to what you want, you get very annoyed with them, right? So what are the signs of a panic attack, right? Panic attack is it's like a physiological response, right, that people go through. Hyperventilation, right? Heart palpitations, your heart starts beating, dum, 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 dum. Nausea, you could start vomiting, chills or hot flashes, you feel very cold or you feel very hot. Sweating is very common, trembling, shaking, your hands start shaking. Numbness, tingling, right? Dizziness, a lot of this happens, right? There are two more that I wanted to add to this infographic. The fear of dying or losing control, right? Shortness of breath. And you feel like you're going to die, right? That's often what people describe when they're going through a panic attack. They really feel like they're dying, right? They're not really dying. They're not in any actual threatening situation, but the anxiety is so strong that they go into a panic attack, right? Oftentimes you get these kind of symptoms when, for example, people are trying to do public speaking for the first time and they're shaking and they're sweating, right? It can be quite difficult. Okay, now there are two types of anxiety disorders I will briefly cover. First is generalized anxiety disorder. So we call this GAD for short, right? GAD, GAD. Now, this is an anxious response to many different stimuli, right? So it's general, that's why it comes from the word generalized, right? So many different stimuli. And then we've also got phobias, right? Now, phobias are anxious responses to specific stimuli, right? Something specific. For example, I have a slight phobia of lizards, right? You know, small house lizards, they hang around the walls and stuff like that. So I've got a slight phobia towards lizards. In Malaysia, we call lizards cicak, right? That is the local term for the house lizard. We call it a cicak. And whenever I see a lizard, I feel very, in my language, we say geli, right? In our local language. In English, the easiest way I can describe that is like you get this, the heebie-jeebies, right? Is there an English word for geli? It's like you feel goosebumps, like you get goosebumps, kind of like goosebumps, not exactly, but you know, you get the feeling of creepy crawlies or heebie-jeebies, goosebumps when you see something that you're a little bit anxious about. Even though I know logically it can't hurt me, but for some reason I get this fearful response, right? So GAD to generalize towards many different things, phobias is specific, right? So let's look at this, anxiety disorders, right? In the DSM, I love consulting the DSM because, you know, that's what helps us as psychologists understand disorders. So you can see that the different sections of the DSM for anxiety are separation anxiety, selective mutism, specific phobias, social anxiety disorder or social phobia, panic disorder, panic attack specifier, agoraphobia, general anxiety disorder, which is what we just mentioned, substance medication-induced anxiety disorder, and so on and so forth, right? Now at the bottom there, I've highlighted something and I'm going to remove it in a moment. Fear versus anxiety, right? So sometimes we mix up these words and oftentimes we use them interchangeably to mean the same thing, but they actually have a specific meaning for each of them, right? What do you think is the difference between fear and anxiety? What would you say? Right? Think about it for a minute. I'm afraid of something, I'm anxious about something. What is the difference? There's a very slight difference there. Of course, again, we use it interchangeably, but according to the DSM, let's read the sentence together. Anxiety disorders include disorders that share features of excessive fear and anxiety and related behavioral disturbances. Fear is the emotional response to real or perceived imminent threat, whereas anxiety is the anticipation of future threat. Obviously, these two states overlap, but they also differ, with fear more associated with surges of autonomic arousal necessary for fight or flight, thoughts of immediate danger and escape behaviors, and anxiety more often associated with muscle tension and vigilance in preparation for future danger and cautious or avoidant behaviors, right? And so on and so forth. So what we can understand from this is that fear is, for example, looking at a great white shark in the ocean, right? You know that there's a threat there, you feel afraid, and you want to try and escape the situation. Anxiety, on the other hand, is a perceived anticipation of is an anticipation of a future threat, right? So you haven't even gone swimming in the ocean yet, but you anticipate that, oh my gosh, what if there's a shark in that water, right? And you anticipate, I'm so worried, I'm so anxious, right? So that's anxiety. It's in preparation for a possible future threat, whereas fear is when you're already responding to a threat that you can see or is imminent, right? So that's the difference between them. Right. Okay. That's a picture of me taken several years ago. I was doing a balloon show for some kids, and you can look on top of my afro. There's a little bird there. That's my pet dove. I call it Birdie. Hi, Birdie. And so I'm showing this picture because one of the case studies in your syllabus is about bird phobia, right? People who are afraid of birds. Now, I'm not afraid of birds. I use birds as part of my magic shows. I'm a magician. And so I use my dove, and children, you know, they love seeing a bird appear during the magic show, right? Although, funnily enough, most people think it's fake. Every time I do a magic trick and I make the dove appear, the first question I get is it a real bird? And I'm always like, you just saw it fly around the room and you're petting it and you still think it's fake? I'm like, hello, it's real. But anyway, so this is a case study of Kimya, female, 39 years age. This is in your textbook, right? She had a fear of birds. Fear of birds is called ornithophobia, right? Ornithophobia, right? The cause, however, was not very clear as far as the textbook says it's unknown. So what happens is that because she's afraid of birds, she avoids places with birds. Now, if you think about it, the outside is, you know, full of birds flying here, there, everywhere, right? So she can't even see photographs with birds, right? Just pictures on paper. She can't see them. the sound of wings, she can't even bear to hear the sound of flap, 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 right? That sound of wings in the air, right? She can't even bear to hear that. Even thinking about feathers makes her feel anxious, right? So her phobia is fairly severe, even thinking about feathers makes her feel anxious, right? And so I have another friend as well. This is a personal friend of mine who also has ornithophobia, right? She's also got an intense phobia of birds, and you can actually read the excerpt. So I asked her a few questions as a casual interview on WhatsApp, and this is an actual real-life case study. I've named her Rachel. That's not her actual name, right? This is a pseudonym that I've given her. So I'll just read it out together, and you can understand and get to see a real-life person with ornithophobia. So the first question I asked, how old are you currently? She said she was 27 years old at the time. What do you have a phobia of? She said fear of birds, any kind. Unless it's like one sparrow a few feet away, haha, I'm okay. The bigger, the scarier, right? So there's a slight difference here. Depends, if it's just one little bird, she's okay. I asked her, at what age did you find you had this phobia? She said, the funny thing is, when I grew up with my grandma, she used to rear chickens. I think it was about 3 or 4 years old maybe. And the earliest memory of a bird I have was when I saw one of my grandma's dead chicken. I think it started from there, I'm not sure. But as long as I can remember, I've always been afraid of birds, except penguins, they're cute. Haha. So notice that difference, right? She saw a dead chicken, she's afraid of birds, but not penguins. Okay, interesting. I asked her, what do you think caused this phobia? I think it's my grandmother's dead chicken, haha. But I remember looking at the dead chicken and not fearing it. Not sure what happened after that. Even until now, I am actually afraid of both dead and alive birds. Now, this is interesting, right? She remembers specifically about the dead chicken that the grandmother had. And later in our video, we're going to cover something interesting that's going to relate back to this. But I want you to turn back your memory and think about your AS studies. Does anyone, for those of you who studied A levels and you're listening to this right now, can you remember any of the studies in our AS syllabus that covered something similar to this, a phobia? You guys remember? It was of a little button boy, right? The button boy phobia, right? So this boy, if you remember from the study, he did not have a phobia of buttons at first, but when buttons fell down on him, he suddenly developed a phobia. And his phobia wasn't just about fear, it was actually based on disgust. And so when she was telling me this, and she said that she didn't fear the dead chicken, immediately in my head I realized, okay, the reason why she has this phobia is probably because she's not afraid of chickens, but rather she's disgusted by chickens, and that has translated into a phobia. Okay, but anyway, I digress. Let's move on to question number 5. I asked her, what do you think about when you experience this phobia? And she said, that's the thing, my mind goes blank, but my body goes into flight mode. So as we looked at earlier, right, fear is when you go into this flight mode, you want to escape this terrible situation. Right? What emotions do you feel when you experience this phobia? Anxious or scared? I think I've told you before too, sometimes I have nightmares about birds, and at that point, all I feel is anxiety. Sometimes I wake up and I can feel it, but my heart is racing, my heavy breathing, right? So of course, this is anxiety because when she's having a nightmare, she doesn't actually see a bird around her, right? It's in an imagination, so she perceives a threat. Okay. 7, how do you behave when you experience this phobia? She said, scream like mad and run away. Have you sought treatment to help you manage this phobia? No, I have not actually. Most people just laugh when they find out about this. But I'm afraid if I do go for therapy, they would want to try exposure therapy. In that case, hell's no, right? So obviously she knows, she is actually a psychology student, and she knows that exposure therapy is one of the common ways of treating a phobia, right? You expose people to what makes them feel comfortable until they get used to it, right? And she's obviously very afraid and she doesn't want to do that, but that's her choice, right? Also, I have actually walked with her on the street where we were near some chickens and some birds, and I would actually have to walk nearer to the birds and protect her in a sense, or she would walk around on the other side of the road when she sees like a crow or a pigeon or something. So I've seen it actually in real life. Now, I did ask her, how has this phobia affected your daily life? She said, I don't think it affects me greatly, just that sometimes when I go out and there are birds, especially pigeons because they're everywhere, it can be quite embarrassing because people can see me trying to avoid and run away. There were times I had to eat out alone because there was this pigeon strolling around in the shop, and I had to move tables so many times until I had to ask the Anne. Anne is the Indian word for Tamil word for older brother, right, to chase the bird away. Then he kind of laughed at me, Rose. At work, there are 1 or 2 shops downstairs that has pigeons walking in, so I just don't go there for lunch. There are times when people, friends, waiters had to help me in terms of chasing the birds away, which can be quite embarrassing for me because everyone is watching and staring at me. When I moved into this new place 2 years ago, I remember seeing a pigeon on the balcony, so we had to bird-proof the balconies by adding some nets so they can't land. And yes, Daiso got sell bird repellents too, which is kind of useful, right? Although she can still live a fairly productive life and she can hold a job and all that, as she said, the biggest problem here is it's very embarrassing, right? Nobody wants to tell their friend, oh, I'm so scared of that pigeon, and everyone's like, huh? Pigeon? It's just a pigeon, right? If it was an eagle coming to attack you, that's fine, right? But if it's just a pigeon or a crow, you're like, huh? That also, you can't even sit next to a pigeon, right? So obviously it's very embarrassing, and I've never embarrassed her in public about it. I do have to try and protect her from the birds, or I walk with her on the other side of the road. But this happens, right? And she obviously is very scared of birds, and she doesn't seem to want to go for therapy. But that is her choice. But I thought I'd give you this insight into someone who actually has a phobia, and we're going to revisit this idea. Keep in mind this concept of her seeing the dead, her grandmother's dead bird, right? The dead chicken when she was a young girl. Okay. All right. So there's another phobia, another very common phobia of people. This is a picture of a woman. She's looking outside. She doesn't want to go outside. It's very scary. Anybody know a phobia associated with that? Okay, this is called agoraphobia, right? Agoraphobia. Now, this is an anxiety disorder people feel because they're very fearful, and they want to avoid situations where they might feel panic, trapped, or helpless, right? So these are situations which they're probably not very comfortable with. In their house, people are usually comfortable in the house, but they don't want to go out, right? Because they might feel panicked if they feel, trapped. I get trapped in a crowd, or I'm somewhere I don't know, and I feel helpless, right, in the empty field, and there's nobody there to help me, right? So it could be standing in line or being in a crowd, right? People can feel trapped if they're queuing up in line. Being in an open space, right, in an empty field with nobody around, you can feel panic. This agoraphobia. Using public transport, right, that can be very, very nerve-wracking. Being outside the home by oneself, right, that can also be very, very difficult for people, right, which is why they usually just stay at home because it's safer. Being in an enclosed space, right, so in a small room perhaps, and they might feel like, oh my, I can't get out, right, so there's anxiety there. They experience fear and anxiety, so because of that, they actively try to avoid these kind of situations, right? It's better to just stay at home. I don't want to go out anymore, right? And obviously, if you just stay at home all day and you don't go out, this is going to severely impact your social life, right? Severely. All right, let's talk about another phobia. Are you feeling a little bit the heebie-jeebies when you see some blood and a needle, right? I used to feel like that. Sometimes I still do, but not as much anymore. There's a phobia for this. We call it hemophobia or blood phobia, right? So this is the irrational fear of blood. Why do we say a phobia is irrational, right? There are rational fears. A rational fear means a fear that makes sense, right? If there's a king cobra in front of you and a king cobra can bite you and kill you, and you feel afraid, you should feel afraid, right? You could die, right? So king cobra, irrational fear. There's no irrationality there. But blood is it's like this liquid that's red in color. If you see it and you feel afraid, that's irrational, right? There's nothing there that can hurt you or harm you in any way, right? So this fear is not just blood itself. It can actually be extended to injections, needles, or invasive medical procedures, right? So what happens is that people will get injections, even if they don't see blood, just the sight of a needle or of the doctor about to inject you, that can give them this phobic reaction, incredible anxiety and fear, right? In fact, I was recently vaccinated for COVID-19, and it was such a big needle, but it didn't really bother me. What I usually do is I pinch myself just a little bit on my thigh or my finger on my other hand, and what happens is that I feel like if you experience pain from another part of the body, the pain from the injection is lessened, right? Is lessened. At least that works for me, right? So when people with this phobia, when they see blood or any of these things, that it increases their heart rate. The heart starts beating, pum, 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 right? And what happens is that something interesting happens. Even though their heart rate increases, they get a drop in blood pressure. And so this results in fainting, right? Oftentimes, you'll notice this especially in movies, right? Someone sees blood and they're like, and then they drop to the floor. Another time that you see this very oftenly stereotyped in movies is that when someone's giving birth, right, the baby comes out, and usually it's a guy as a joke, the guy looking at the baby coming out of a woman's womb, and he just drops to the floor fainting, right, because he's never seen that before. So what's interesting is that even though your heart rate might be increasing, your blood pressure actually drops, right? So that can happen, right? Okay, now moving on to another fear. What is the fear of buttons called, right? I mentioned it earlier, right? The button phobia. It's called Compoundophobia. We won't actually cover this in much detail, but I just asked this to my students in class, see if they can remember. So now we've talked about several phobias. General anxiety disorder. We've talked about specific phobias like ornithophobia, fear of birds, hemophobia, fear of blood, agoraphobia, fear of fear of being in an enclosed space or in a place that you feel helpless, going out in in public and stuff like that. Right now, how do we measure phobias and anxiety? Right, we need a way to measure it scientifically and accurately. So we use something called the Blood Injury Phobia Inventory, BIPI. Right, this is specifically, as the name suggests, to measure blood phobia. Right, so it measures hemophobia specifically. Right, it provides 18 different situations featuring blood and injections, right? It's a type of self-report, so a person can just do this on their own. It's about situation and reaction. I'll show you some examples later, and it tests about your cognitive, your physiological, and your behavioral reactions, right, to situations involving blood and injections. Okay, you will have to answer the frequency of your symptom of experiencing this from 0, you never experience this, or 3 to always, right? So here, for example, it's a little bit blur, but look at the situation down there, right? Can you see it? When I see an injured person after an accident bleeding in the road or on TV, right? And if you turn your head to the left, you can see, I don't think I'll be able to bear the situation. I think that something bad is going to happen to me. I perceive that I'm not much time before I get dizzy. I feel confused, disoriented, and so on and so forth, right? The second one you can see on the left side situations, when I see blood on my arm or finger after pricking myself with a needle, when I get an intravenous injection, IV, right? When I see a laboratory tube with blood, when I hear a conversation about blood. So, it's all about that, right? So a lot of questions about that and blood and injections and so on, and people have to respond accordingly, right? How would they react when they see things like that, okay? So that's for hemophobia. What about generalized anxiety disorder? So there's something called the GAD-7. Okay, if you can guess what the 7 is for, good for you, you get a cookie, right? So this is a type of screening test, which is after doing a screening test, you can then usually consider a referral to a psychiatrist if you score particularly high on this test, right? So these are just like, that they shouldn't be taken as a 100% diagnostic test where if you take the test and you mark yourself and you see that you have high level of anxiety, that doesn't mean you have a disorder. You still have to go to a psychiatrist, right? So there are 7 items, that's where the number 7 comes from, my favorite number, that measure the severity of anxiety, right? It also measures based on the frequency of the symptoms from 0 to 3, similar to the previous scale. 0 is not at all, 3 is nearly every day. Is this a diagnosis? No, it is not a diagnosis. It's just a screening test. It's a simple tool that you can use to measure your own level of generalized anxiety disorder. And if you feel concerned, you can then go and consult a psychiatrist. I can't remember if I got a copy of this. Okay, I did, yeah. So on this one, the first one, feeling nervous, anxious, or on edge. 0, not at all. 1, several days. 2, more than half a day. 3, nearly every day, right? Number 2, not being able to stop or control about worrying, worrying too much about different things, trouble relaxing, and so on and so forth, right? So as I always tell my students, for A2 level, please pay attention to all the scales that are given and make an effort to memorize the information in the scale, right? So memorize at least 2 of the items as well as the scoring of the scale. Just think about the scale in general. What kind of scale is it? Is it qualitative, quantitative? Think of some examples from the items so that when you're writing answers, especially for essay questions, you can give all this information as great detail. Okay. You can find this. You can find pretty much all of these scales online. You just have to search on Google and be smart about how you find them online. You shouldn't have an issue, right? Okay, so let's evaluate some of these measures, right, when we think about it. Okay, so validity is a very common thing that comes out when we talk about scales, right? We want to make sure that these scales are valid. Are they accurately measuring what they claim to measure? One of the common ways of measuring validity is concurrent validity. Your syllabus doesn't go in depth into validity. There are a lot of types of validity: divergent, convergent, concurrent, discriminant, and a lot of different words. A common one that I see in your textbook is concurrent validity. And now I've explained this in a previous video. Concurrent validity is when you have 2 scales and they move together in an expected direction. For example, let's say you had a scale on happiness and depression. So if the same person takes both scales, they should score, if they score high on happiness, they should score low on depression, right? Because they're obviously not depressed. If they score high on depression, they should score low on happiness, right? That makes sense, right? Why? Because, it's opposites of each other, right? So you would expect something known as you could call that concurrent validity. Another way could be 2 scales in the same direction. Let me think of one example. So perhaps anxiety, right? So generalized anxiety disorder, GAD-7 scale. If someone scores high on the anxiety scale, you would also expect them to score high perhaps on a global functioning scale, right? Then, I think of another scale that they can score high in. Let me think. I can't think of one off the top of my head. I always think about something like depression. High in anxiety would be high in, let's say you had a scale on fearfulness, right? So they score high on anxiety, you would expect them to score high on fearfulness as well. So there's concurrent validity, both of them are moving in the same direction. So when you find out about these scales online, you can often just type like psychometric properties of the BIPI, right? The blood phobia inventory scale, right? Or psychometric properties of the GAD-7. And you can easily find references and articles online which will describe those properties, okay? Whether it's valid or reliable. Also, most of the scales that we use in psychology are oftentimes self-report. And so are self-report scales accurate? You know, when you have to evaluate these things, what are the benefits and the disadvantages, right? The benefit of a self-report is that people can do it in their own time. They don't have to feel pressure to do it. They can do it in their own privacy. And, you know, perhaps that may allow them to be more honest than usual, right? On the other hand, what are some of the problems of a self-report scale? Is it accurate all the time? Are people sometimes biased? If you ask them something personal in the form, are they likely to lie? They could, right? You don't know because it's a self-report, so there's some bias there, right? When we talk about psychometric, psychometric refers to the whole study of measuring certain characteristics about human beings, right? So things like validity and reliability, those are things that we call psychometric properties. Now, what are some of the issues here? I wrote the word complex experience because things like a phobia, right? A reaction that you have to something that scares you. These are complex experiences, right? When the feelings that you experience, the physiological reactions, they can be quite complex and they can be different in different situations. So the question really is, if you use a scale with something as simple as 0 to 3, can you really quantify such a complicated experience that a person goes through? Is it possible? Well, to a certain extent, yeah, it is possible, right? It is quantifiable to an extent. But is it necessarily going to be accurate? Shouldn't we interview a person and understand them in more depth, right? Like how I did with my friend Rachel. I asked her a bunch of questions and I got some very in-depth responses. If I had just given Rachel a scale, she would have just given me 0, 1, 2, 3. Right? That doesn't give me anything about her history, what happened to her and the reactions that she goes through. Yeah, I would get some data, but is it always good to use psychometric scales, when measuring such things? What about cultural bias, right? Oftentimes, from what I read, in articles, is that people tend to compare North American or Western cultural values versus Southeast Asian or Asian cultural values, Western versus Asian, right? Individualistic cultures versus collectivistic cultures, right? And oftentimes that does happen, right? There is a cultural bias to certain phobias. Perhaps, for example, oftentimes Westerners are usually perceived, at least, I'm from Asia, so, we usually perceive Westerners being more extroverted, right? Being more sociable, being willing to mix around with strangers more easily. And I found that to be true. When I visited America for the first time, I did feel like, actually, they are really much more sociable when it comes to, being with strangers. Whereas in Asia, we don't usually socialize with strangers as much as perhaps Westerners might, right? So for us, if we stay by ourselves in our houses, a Westerner might look at us and say, wow, you've got agoraphobia, right? Because all you do is stay at home. No, but that's not true, right? It's just that we have a different cultural way of living, right? So there are often cultural biases because these scales are created oftentimes in America or in Western countries, and they don't have an Asian counterpart sometimes, and just the way that we live is just different, right? So you can't always encapsulate that. Okay, so let's look at the explanation. We looked at the symptoms, right? What are the symptoms and the different types of phobias that people experience. Now, how can we explain phobias, right? So there's behavioral, psychoanalytic, biomedical, and cognitive. Okay, behavioral. Okay, we're going to talk about classical conditioning, possibly one of the most famous experiments to do with classical conditioning, right? It's the Little Albert experiment, right? Now, I'm not going to go into in-depth about the Little Albert experiment. I'm just going, if you want to read it in more detail, it would be good to what's the word for it? It'd be good to research this, right? Good to research this, yeah. So because it is a very important experiment in psychology because it teaches us a lot about classical conditioning. Okay, so what's next? Okay, so if you're confused by any of the terms there, UCS, UCI, and I'll briefly explain them. If you need more clarification, you can go and find videos online or more information online, right? So what happened in Little Albert, a very simple example, is that, a very simple brief explanation is, they had a little baby, they brought him into an experimental room, right? And John B. Watson was the name of psychologist in charge of this. He would introduce small animals to Little Albert, like a white rat, right? He showed little Albert a white rat. Now, little Albert, being a baby that had probably never seen a white rat before, was not afraid of it. He would be quite okay with it, quite neutral. He might play with the rat, touch the rat, that was fine, right? So he wasn't afraid of the rat. The problem was when John B. Watson, the psychologist, he then introduced the rat a second time, and he created a loud bang, right? He banged something very, very loudly, and children react naturally to loud sounds by crying, right? It's a very natural human response. When you're a child, bang, you start crying, right? And so when the psychologist associated the sound of the banging and the rat together, the poor little baby, little Albert, he then associated the rat with fear. And so now, when he sees the rat, he starts to cry. And so this is described in the table. Before conditioning, there's something called the UCS, which stands for Unconditioned Stimulus, right? This is the loud noise. We call it unconditioned because we don't have to condition or teach a child how to react to a loud noise. The child just reacts naturally, right? So that's the loud noise. What about the UCR? UCR is Unconditioned Response. So unconditioned response is crying, right? So crying is what happens when children hear a loud sound, bang, and they start crying. It's called unconditioned because you didn't have to teach or condition the child to respond in that way. They naturally respond in that way, right? For example, when a child is hungry, he eats, right? It's a natural response. Next, during the conditioning, so when they paired the white rat and the loud noise, NS is called the neutral stimulus. What was neutral? The white rat, right? The white rat is neutral because the baby has probably never seen it, it's not afraid of it, and they put it together with the loud noise, right? So white rat, NS, neutral stimulus, plus together with the loud noise, which is the unconditioned stimulus. So white rat, bang, and they repeat this a few times, and then the baby starts crying, obviously because it hears the bang. It's not crying because of the rat, it's crying because of the sound, right? Then after conditioning, we now have the CS. So from the UCS, we now have the CS, right? Which is the white rat. The white rat, when we paired it with the loud noise, sorry, not the UCS becomes the CS, it's the NS that becomes the CS. CS stands for conditioned response, right? I don't have to make the loud noise anymore. I just have to show little Albert the rat, and guess what? He starts crying. That's the conditioned response, right? So I taught Albert to cry when he sees a white rat by associating the white rat with a loud noise over several times. So this was a rather unethical experiment in the eyes of many people because unfortunately, as far as the records show, John B. Watson did not make any attempt to remove this conditioned response from little Albert, right? He made him afraid of all these animals and rats, but he didn't remove that fearful response, which was rather unfortunate. And it seems like a rather cruel thing to do to a little baby, right? Please read more information about this in your textbook, or you can go online and find it. It's a very famous experiment. Okay, so that's, I should explain. So this behavioral classical conditioning explains how phobias happen, right? It explains that phobias can happen when you see some animal or something and it's associated with something that you naturally, have a fearful response that can cause you to be phobic towards it, right? It doesn't have to be a loud noise or something. It can be anything that just creates a fearful response. For example, my fear of lizards was most likely classically conditioned because my mother was afraid of lizards. So every time she sees a lizard, she screams and she jumps and she makes me feel afraid. Even though as a child, children are not afraid of lizards, in animals in general, right? Because they're just animals, right? A child doesn't know any better. But if you see your parent reacting in that way, you learn from watching, right? Of course, this is more about observational learning and, rather than classical conditioning, but it gives you the right idea, right? So that you can use the behavioral explanation by saying you paired this item with this response, and that's why you have this phobia, right? Let's talk about psychoanalytic theory. Now, this is proposed by Freud. This can be a little bit difficult to understand, but I'll try to explain it as simply as possible. So Freud believed that anxiety and fear, Freud, by the way, Sigmund Freud, one of the great pioneers of psychology, right? He believed that anxiety and fear was caused by impulses of the id, right? That's not ID, it stands for id. I'll explain it in a moment. The id becomes denied or repressed, right? And that results in fear. Phobias are a manifestation of internal conflict within the mind, right? I'll explain this with an example later on. And phobic objects symbolize a psychosexual conflict, okay? It sounds like a lot of jargon, but don't worry, I'll break it down piece by piece, and we'll look at a case study which exemplifies this a bit clearer, okay? First, we need to understand his theory, right? So Freud's theory was about the id, the ego, and the superego. This is psychoanalytical theory, right? He believed in the human mind right? I'm not referring to any parts of the brain specifically. I'm just referring to how we think, right? He believed there are three parts, right? The id on the left says that I need to eat right this second. I need to eat right this second. I need to eat right now, right? The ego in the middle says you can't do that because you're in the middle of an important meeting, right? The superego says eating during an important meeting is rude and inappropriate, right? So what's going on here? It's kind of like a court case, right? On the left side, the id represents all our basic and primal desires, the things that we want to do right now. I want to eat right now. I want to have fun right now. I want to do this right now, right? That's the id. The id just wants to pleasure itself, right? On the right side, the extreme right, we've got the superego. The superego, as you can see there, is like, dressed up like a judge, right? The superego is our moral compass, right? It's our sense of morality. It wants to say what's right, what's wrong. We cannot do this, we can't do this, right? It's always about keeping us in a moral check, right? So the id is all about going wild, doing whatever you want. Superego is all about being in, making sure that everything follows the rules. The ego is the balance in between. It's like our consciousness, the ego balancing in between the id and the superego. So the ego says, okay, I know id, you're hungry, but guess what? The superego says it's not good for us to do that because it's very rude. So what we're going to do is we're going to wait first and then we're going to eat after the meeting, right? So that's what the ego tries to do. It tries to balance between the id and the superego. And when there's a conflict, that can result in a phobia, right? So this is a very common cartoon depiction of what the id, ego, and superego look like, right? The id is like the devil, just wants to have fun. The superego is like the angel, wants to do always the right thing. And the ego is in the middle, trying to figure out how to balance between them. This is from The Emperor's New Groove. It's a very underrated animation film. I absolutely love it. It's so funny. Please go and watch it if you haven't, right? Okay, Freud also had psychosexual theories, and what he believed was that there were two types of complexes, right? The Oedipus complex and the Electra complex. Now, this is a little bit weird. I don't fully agree with it, but it's Freud. So in the Oedipus complex, boys want their mothers, not just in a loving way, but in a sexual way. Boys want to be sexually, sexually active with their mothers, in a sense, right? It sounds weird, I know, but bear with me, okay? And they see their father as a competition, right? They see their father as a competition. So that's the Oedipus complex. It's based on Greek mythology, where Oedipus was the king of a place called Thebes. He accidentally killed his father, if I'm not mistaken, and married his mother, right? And so that's where Freud drew the inspiration from. He noticed that young boys, they love their mother sexually, not just, it's normal for children to love their parents, but this goes beyond just normal love. It's a sexual kind of feeling, right? And you want to be with your mother, you want to have your mother for yourself. And then because your father's married to your father becomes your competitor, right? And you hate your father and you love your mother. That's kind of the Oedipus complex. The opposite is the Electra complex. Girls want to be sexually active with their fathers, right? They want their fathers, and then they see their mother as a competition, right? So it's exactly the opposite. Again, you don't have to agree. It's a bit of a strange theory, and I don't know whether any psychiatrist actually uses this, but that's what Freud's theory was. Okay. Now we come to a case study in your textbook syllabus about Hans and the horse. This is a bit of a strange case study, but we'll try to make sense of it as much as possible. Okay. So, case study of Hans and the horse, right? So you can get this in your textbook as well. Hans is a 5-year-old Austrian boy, right? Young boy. When he was 3 years old, what happened was he had a significant interest in his penis, right? So he would touch it, play with it, and all that. Not so much in a sexual way, but I suppose he was just interested in his penis, right? Or over a little bit too interested, more interested than usual, right? And his mother then, when she noticed this behavior, she threatened to cut off his penis, right? If you keep playing with your penis, I'm going to cut it off, right? So this instilled what is known in him as a fear of castration. Now, it's actually quite normal for children to explore their own bodies and touch themselves, right? That's normal. And as parents, you should teach your children about their body parts, right? Not scare them, right? You shouldn't shame them. You should just teach them. They're children. They don't know any better, right? We should educate them and not instill fear in them. So that was one of the problems. She instilled this fear of castration in him. Castration is, cutting off the genitals. And then when he was young, he saw a horse fall down and die, right? He saw this happen when he was young. And then, since then, he had a phobia of being bitten by a white horse. That was his phobia, a phobia of horses, right? What was also interesting was that in his case study, he enjoyed going to his parents' bedroom and sitting with his mother. But he was now denied going to the parents' bedroom, right? His father denied him. He used to love going to the bedroom and, keeping his mother company. His father started to deny him this privilege, right? He also had two fantasies. Hans had children with his mother, so he imagined, having sexual relationship with his mother, giving birth to children, and he imagined his father as his grandfather rather than as his actual father, right? He also had a strange fantasy of a plumber having replaced his penis with a new and larger penis, right? So it was a very strange fantasy, right? So this is a rather strange case study, but how did Freud explain it, right? So I believe Hans's father went to Freud and asked for help, right? So Freud said, okay, analyzing your son based on his case study, the object of fear here is the horse, right? That's the object of fear. He's afraid of the horse. It's a phobia of horses. But actually, what he's really afraid of is the father, right? He's just displacing his fear for the father onto the horse. Sorry, not displacing. What's the word for it? Projecting? I can't remember the exact word. But the actual fear that he has is towards his father, not the horse. But the horse is just the object that he's using for displacement of fear. Right? So the anxiety and the fear, the reason why he feels anxious and afraid is because of the castration threat, right? So he's playing with his penis. That's probably the conflict between the id, the ego, and the superego. The id just wants to touch the body parts and just do whatever he wants, and now he's in conflict. The mother wants to threatens to cut off his penis, so he's in conflict there. Doesn't know what to do, and also he was denied going to the bedroom, right? Remember the Oedipus complex, right? The Oedipus complex about him spending time with the mother. He loves his mother, more than usual, and now he sees his father as a competition, right? So now he's not allowed to go to the bedroom and spend time with his mother, right? So that's a problem, right? He creates anxiety, conflict in his mind, right? And this results in the Oedipus complex, and that also shows evidence because he's having fantasies with his parents, right? He's imagining having sex with his mother and having children, right? And his father's out of the picture. His father's the grandfather. And he also imagines for some reason a plumber is replacing his penis with a new, bigger penis, right? So all of this, Freud analyzed and said the cause of his phobia is due to the Oedipus complex, right? All this anxiety that's going on in the family, right? You can, you may disagree, you may agree, it's up to you. I personally don't buy into such a strange interpretation based purely on a case study. But, that was Freud during his time, and, pretty sure Freud did a lot of cocaine, but, such is life. Now, Freud suggested that Hans' phobia was caused by his Oedipus complex. That was his professional suggestion. But can you suggest an alternative explanation? What do you think, based on his case study? We saw earlier, remember, that's why I pointed to my friend earlier with Rachel and the birds. She felt afraid because she remembered when she was a child, she saw one of her grandmother's dead chickens, right? And I suggested that it's possibly a feeling of disgust that was the cause of her phobia. In this case, Hans saw a horse fall down and die. Don't you think that could have been a link, right? Maybe the death of the horse makes him feel afraid, and he's putting that phobia onto horses, right? Biting him, and perhaps he's afraid he might die, right? So as you can see, I think that would make a far more logical explanation. That's me, and I'm not Freud, so it's up to you. Psychology is often open to interpretation and things like that. Anyway, let's move on from that wild story to the biomedical approach. Okay, this is by Ost in 1992. Ost believed that there was a genetic predisposition to a fear of threatening stimuli. Now, this makes sense, right? If you believe in evolution, not if you believe in evolution, if evolution happens the way that it happens, right? It selects certain things in an organism to make sure that organism survives. And if you're afraid of something that's threatening, you're more likely to survive and escape and stuff like that, right? So it makes sense that there's some kind of evolutionary mechanism to protect us against danger, right? In that sense, right? The same way that dogs naturally just want to run after cats, right? There's some evolutionary mechanism of predator and prey, right? So that makes sense. And he believed that because it's evolutionary or genetic, it should be able to transmit through DNA to help us in our survival, right? That's what he believed. Now, what he wanted to test this on was on blood phobia, right? So he got 81 blood phobic and 59 injection phobic participants. So blood phobic basically means they've got blood phobia, they're afraid of blood. Injection phobic means they're specifically afraid of injections. And others, specific phobias, they are not mentioned, right? He did a screening of all these people, asked them to do several self-reports, and gave them a behavioral test. If you want to know what these are specifically, please go and read the actual study. Okay, it's quoted in your syllabus. He then showed them a 30-minute silent video of surgery. Right? So they watched a 30-minute video of surgery, and then he also presented 20 steps of a live injection. Right? That was described. The 20 steps that go into an injection. Opening the needle, taking out the cap, injecting it into someone's arm. So he listed out in 20 steps. Okay, and then they were rated on their performance Were they able to watch the whole video? Did they stop halfway? Was there any fainting? Did they feel any anxiety? After watching the surgery, did they faint? After reading the steps of injection, did they feel anxious? Right? And what were the results? These were the results. 50% of blood phobics and 50% of injection phobics had one or more parents with the same fear. Right? So 50% of the blood phobic group had a parent with the same fear, or more than one parent. 50% of the injection phobics had more than one parent, right? So that does show some evidence of genetic predisposition, right? If one or more parents has it, it seems that the children 50% of the time seem to have it, right? So 21% of the blood phobics also had a sibling with the disorder, right? So the higher that percentage of concordance, we learned that word in a previous video, right? Concordance means how, if one has it, does the other sibling have it, or the other twin have it, right? And we see that the siblings have a 21% chance of having it. Parents, have a likelihood of having it as well. So that gives some evidence for genetic predisposition. The next result was 70% of blood phobics and 56% of injection phobics had a history of fainting due to stimuli. Right? So there's a strong relationship between this fainting and the blood phobia or injection phobia. Right? In fact, fainting is a lot higher than other specific phobias. Right? Oftentimes you'll notice this to be true. When people are afraid of animals like dogs, snakes, lizards, stuff like that, they don't usually faint. But when people see blood, they suddenly faint. Or they see an injection, they faint. Right? It's a very uncommon reaction you'll see to other phobias. Other phobias, people usually just scream and run. Right? Like my friend Rachel with the birds. Right? If she sees the bird, she screams and runs away. Right? She wants to fight, flight, escape. But with blood phobia or injection phobia, it's very specifically linked to fainting. A little bit more usual than other specific phobias. He also found that 10.8 blood phobic and 7.7, okay, this was the mean of fainting incidences, right? So more of the blood phobics fainted, and quite a number of injection phobics fainted on average, right? But less than the blood phobics, right? So blood phobics tend to faint more, injection phobics faint less during the study, right? Talking about blood phobia and injection phobia, I was actually part of an advertisement. So I work as a model in my country because of my afro. Some people like to hire me. And so this is actually a public service announcement to get people to donate blood. So if you watch this video, I won't show the actual videos, otherwise it'll be taken off YouTube. But these people are all staring and they're all like, oh my gosh, what's happening? Oh, it's so anxious, I'm so afraid. And they're all donating blood. And I believe I appear somewhere there. Where's my face? There I am. And my glorious afro moving from left to right. And then reverse, and whoa, look at that. So my hair was bigger then. And actually scared, the hashtag was scared not scared. As you can see, she's just, preparing to take blood. They still think of others. Selamat Hari Merdeka. This was Selamat Hari Merdeka in my local language is Happy Independence Day, right? So during Independence Day, this company called Astro, which is a TV company, they wanted to do a blood donation campaign, saying that even though people are scared, they're still willing to. I don't know whether I look scared. I look hilarious, but I don't know whether it's scared. They're still willing to donate blood, right? So join the blood donation campaign drive, right? Okay, so biomedical side, let's look at cognitive stuff. So phobias are believed to be something to do with our thought processes, right? It's all to do with biased reasoning, right? When you see things like ambiguous stimuli, like heights or spiders, you find them more threatening, right? Ambiguous here means you're not sure whether it's threatening or not at first glance. For example, there are spiders in this world that can kill you with a single bite, right? The black widow spider, for example. Right? But sometimes if you see a spider from far, you just glance at it and see it's a spider, you may not know immediately whether it's a poisonous, is it poisonous or venomous? I think venomous is the right word, right? Yeah, venomous. Whether it's a venomous spider or not, you wouldn't know, right? So it's ambiguous until you know for sure. And that's why people tend to perceive that in a very biased way, and they tend to overplay its threatening features, right? Or heights. Sometimes you might look over the side and you might think, oh my gosh, that's such a far way away. But actually when you jump, it's like, oh, it's not that far, right? So, and people who have negative self-beliefs, they believe that they can't cope, right? That's also a problem, right? That's to do with biased reasoning. Oh my gosh, it's a spider, I'm going to die, I can't cope with this, I can't handle it, but you can handle it, right? You're just overthinking it, right? You believe that you can't cope when actually you can, right? So DiNardo et al. Did this. He studied cynophobia, which is a fear of dogs, right? 14 dog fearful and 21 non-fearful females, so just females. He asked them to self-rate their fear or no fear, he asked them to do a self-rating scale, and then he separated them into fear or no fear groups, and he did a live dog test, right? So he brought a dog nearby, and he asked them to rate their anxiety, right? So he also did structured individual interviews with each of them after doing the dog test, and they wanted to investigate conditioning events and expectations of harm, right? We'll go to the results in a moment to explain this. Again, I'm just doing a very brief overview for the sake of a YouTube video. Please go and read the actual study in detail, right? So the results showed that 56% of dog fearful and 66% of non-fearful participants had upsetting or painful dog encounters, right? So what does this show? That 66% of participants, that's a higher percentage of participants, were not afraid of dogs, but they also had upsetting experiences with dogs. That means they've gone through painful experiences with dogs. Just like me, my dogs have bitten me before, but I'm not afraid of dogs. I love dogs, right? Because I have a self-belief in me that I love dogs. I love to play with dogs. Even if they're fierce or they bite me, I don't blame the dog. That's just the dog being a dog, right? I don't blame the dog. I'm not afraid of dogs, right? Only 56% of the dog fearful people also, went through upsetting experiences, right? Mostly bites or scratches, right? These are some of the experiences that people encountered in the past, right? All of the dog fearful people and only a small minority of the non-fearful people expected fear of harm. So this is the big difference, right? People who are afraid of dogs expect fear of harm. That means the dog hasn't actually bitten them. The dog hasn't actually harmed them, but they expect the expectation that something bad is going to happen, right? Is affecting all the dog fearful people, right? Whereas for the non-fearful people, only a small minority have this expectation, right? And that's like me. When I see a fierce dog barking, I don't expect much harm, right? I mean, if it bites me, I can always scare it away, right? I'm fairly confident that I can get rid of the dog if I needed to, right? Whereas if I was afraid of dogs, I would expect 100% of the time that the dog is going to harm me, right? So it's the anticipation of harm that seems to be characteristics of people who are fearful of dogs, right? And that anticipation is a cognitive bias. As we can see here, those who are not afraid of dogs, they don't expect the harm. So it's just about our thought processes, right? So the conclusion here is that there is a cognitive bias in people that one, they've gone through painful experiences and they expect dogs to harm them in the future or when they see a dog, right? And that expectation, that biased expectation, then causes them to feel fearful, right? So now we've looked at all the explanations. Before that, we looked at the different types of phobias and their symptoms. Let's evaluate the explanations. So Little Albert, what was the sample size for Little Albert? Which is one case study. Not very valid, right? Because just one sample. Control, was there control? Yes. So there was a high validity in terms of control. Let me rephrase that. One sample size for a case study is not very generalizable, right? Nothing to do with validity, to do with generalizability. Control was with regards to it being an experiment. It was an experimental procedure. Lots of control, very valid in that sense. What about Hans? Hans was also a case study, and it was it objective? No, it's very biased in the sense that Freud has his own opinions about the way he thinks about things, and it's all just based on case study and opinions. Freud did not do any scientific experiment to validate his theories, right? He just came up with his theories based on his thoughts and experiences. That's not objective, right? That's not scientific. So what does that say about validity? He didn't use any scientific experiment to test his study, right? So obviously it's not very valid, right? Ost and Di Nardo, what can we say about them? They used standardized tests, both of them, right? So Ost was for blood phobias, Di Nardo was for the cynophobia, dog phobia, right? Their sample sizes, I can't remember. They had fairly good sample sizes on both sides, I think. Okay, control, they were both, what kind of designs were they using? Please go and read the studies and answer these questions. Cross-sectional, okay? You can look up that word and find out what it means. It usually means when you take when you take a sample of people at a particular time, right? You don't study them over a long period of time. When you study people over a long period of time and see how the effects are, we call that longitudinal studies. If we only take people at one snapshot in time, we call that cross-sectional, or sometimes known as a snapshot study. What about applications to life, right? If something can help us understand the cause better, we can then identify an appropriate treatment, right? So even though, we use case studies, if the case study gives us enough information that it's applicable to help with a treatment, then that's still good, right? It's an application to real life. Of course, it's always better to have a proper, valid, approach. Okay, so let's look at treatment of phobias. There are three treatments: systematic desensitization, applied tension, and cognitive behavioral therapy, right? So what is systematic desensitization? It's reducing undesirable responses, right? So as the name suggests, systematic means you move in a very systematic way, so a very structured way, right? Step by step by step, systematic, that's what it means. Desensitization, right, means to remove sensitivity. So let's say you're sensitive to something. Like for example, my teeth are very sensitive to cold water. So to desensitize my teeth, I need to brush with a very special toothpaste that sort of stops it from being so sensitive, reduces the sensitivity. Right? So if a person has a phobia, they're very sensitive to a particular animal or stimulus, you want to reduce that sensitivity. Right? So this is based on behavioral psychology, right? Because behaviorists believe that behaviors are conditioned responses, right? Our behaviors are things that we learn to do. We learn to do things, right? And if you can learn something, guess what? You can also unlearn something, right? If you can learn to be afraid of something, you can unlearn to be afraid of it, right? Do not be afraid of it, rather, right? So frightening stimuli can be made to be neutral if you go through this, right? Volpe proposed this theory of reciprocal inhibition, right? Reciprocal inhibition is the impossibility to feel fear and calm at the same time, right? So when you think about it, fear and calm are two completely polar opposites of emotions, right? Fear is like, oh my god, something bad's gonna happen, and calm is like, oh, everything's all right, right? So those are they're complete opposites, right? And he believed that you can't feel them at the same time, right? It's logically impossible to be afraid and calm at the same time. Is it possible? No, you can either feel calm or you can feel afraid, right? Or your fear becomes calm or your calm becomes fear, right? So you can't feel them exactly at the same time. Now, of course, you don't have to necessarily agree with him, right? There is some truth to that, right? A polar opposite, negative can't be positive, positive can't be negative, something like that, right? But oftentimes we do, as human beings, we're quite complex and we can experience complex emotions. For example, the emotion of bittersweet, right? Let's say, when I was working in the United States, I worked there for about 4 months and then I had to return back to Malaysia. It was very bittersweet returning back to Malaysia. Why? Because it was bitter having to say goodbye to all my good friends in America. But it was also sweet because I was looking forward to being with my family again, right? So bittersweet. Okay. So first, you have to do relaxation techniques when it comes to systematic desensitization. You make people relax. Why? Because you want them to feel calm. When they feel calm, they can't feel afraid, right, at the same time. Secondly, you create an anxiety hierarchy, right? Anxiety hierarchy is basically in steps. Now, I've covered this in the AS syllabus. This should be just a refresher. If you forgot, you can go back to my other videos and look at the button phobia study and look at it in detail, how the hierarchy was created, right? So anxiety hierarchy is basically, let's say you're afraid of spiders. So instead of giving you a spider, I show you a picture of a spider from far. Then I introduce a small fake plastic spider. And then I bring in a real spider, right? So that's the hierarchy. And whenever this is introduced to you, you have to be relaxed. You can't, if you feel afraid, immediately the stimulus is taken away, right? Third, you process through the hierarchy while you're feeling calm, right? So that's important. You ask them to relax. Okay, take a deep breath. Okay, relax. Okay, look at this picture of a spider. Oh, no, I can't see the spider. I can't see the spider. Okay, stop. We'll take away the picture of the spider. Okay, relax again. Okay, I'm going to put the spider picture further away. Okay, can you see it now? Okay, are you relaxed? Yes. Okay, bring it closer. Okay, I'm still relaxed. Okay, let me bring a plastic spider. Are you still relaxed? Yes, I'm relaxed. Okay, I'll bring a real spider. Oh my gosh, it's a real spider. I can't take it. Okay, obviously they have to feel calm again. So take away the real spider, ask them to relax. And so this repeats until you finally can touch and hold the, phobic object, because you associate the object with calm rather than with fear, right? So that's like classical conditioning again. Okay, so usually I ask my students to design their own anxiety hierarchy, divide into groups, think of a phobia, or I'll give you a phobia, and create an anxiety hierarchy for that phobia. It must have 8 levels, right? 8 different levels of exposure, right? So you can do this as an exercise on your own. Find something that you're afraid of, create some levels of exposure, ask your friends to expose you to it, right, when you're calm. Okay, let's look at another treatment. This is called applied tension. This is specifically for blood phobias, right? Where you are required to apply tension to your muscles to increase your blood pressure. If you remember, when people suffer from blood phobias, their blood pressure drops, right? And so that's why they faint, right? Because there's not enough pressure in the blood. So blood phobia, you have a drop in BP. You want them to apply tension, right? Okay, so OS did this study with 30 patients with blood phobias in the same hospital. The IV, independent variable, was applied tension group, relaxation group, or a combo, right? So what kind of design is this? When people are in one specific group only, what kind of design do you call that? It's an independent measures design, or you can also call it a between subjects design, right? Because each group is independent from each other. So some of the patients were in applied, some in relaxation, and some in a combination of two, right? They were from 18 to 60 years, males and females. Tension was for applied tension sessions were taught over 5 sessions, and relaxation sessions were over 9 sessions. Those in the combo group had 10 sessions in total, right? I'm not sure why they didn't standardize it. I'm not sure why some had less, some had more. That's just the researcher's decision. Before the treatment, they did self-reports and behavioral and physiological measures. Again, please go and look up the actual study and read about what those measures were. Tension was to tense your arms, chest, and leg muscles until you feel warmth in your face. So I tried doing this. tensing my body, tense it up. As you're listening, you can just tense your whole body and see if you feel warm in the face. I don't really feel warm. I don't know how hard you had to tense until you feel warmth in the face, but you should after a while because you're tensing your blood, tensing your muscles, and your muscles are constricting the blood, increasing your blood pressure. So you should feel a bit of warmth, right? And then they had to watch videos or pictures involving blood. What were the results? 73% of participants across all groups had an improvement even at a 6-month follow-up. Isn't that wonderful? That's great because that shows that the treatment really worked. By teaching people to apply tension when looking at phobic stimulus of blood, right? They actually improve even after the follow-up of 6 months. So that's a wonderful thing to see, right? It's really good to see a treatment that actually works and helps people. And it was across all groups, right? Applied tension was only done in half the time, so that would be the most appropriate treatment. So what he means by this is that if you notice, the tension was done in only 5 sessions. Relaxation had 9 sessions, and combo of both had 10, right? So relaxation and combo, they had a lot of sessions, but applied tension was only 5, right? So they managed to have equally a positive effect in half the time, right? So if you're trying to come up with an efficient and cost-effective way of helping people with blood phobia, applied tension would be the best one because in only 5 sessions, you can basically help a person manage their phobia, right? Whereas if you had to do the relaxation or the combo, you'd have to go to 9 or 10 sessions before you get the effects that he found, right? Of course, maybe it could be done in lesser, but he found that you can just do 5 and get the same result. So, why not do less, right? I put the stars in my slides to remind my students to evaluate the entire design, right? So 30 patients from the same hospital. Is that good, bad? Is it generalizable? Well, 30 is a pretty fair, a decent sample size. That's good, but they're all from the same place. So it's not so generalizable on that account. What about the design? You can talk about the design. What about the age and the genders? So a fairly large sample size in terms of the fairly varied sample in terms of the age. It's good that he got both genders. I don't know whether he specifies how many males and females. I forgot if there's a imbalance. The design, between subject design, is it a strength? Is it a weakness? Go look back at your research methodology notes and check that. They watch videos and pictures involving blood. Was it standardized? Is it good to have a standardized procedure for all participants? Right? What do you think? Results were very good, and he did a 6-month follow-up, so it's a longitudinal study because he followed up after 6 months and saw that there were still positive effects, improvement. Is that a good thing? What do you think? Sounds like a good thing? Yeah. Right, so let's look at our final therapy, which is cognitive behavioral therapy. This is like the mother of all therapies, right? Ost and wrestling. So Ost loves to help people with phobias, right? So they were comparing CBT versus applied relaxation for panic disorder, right? 38 participants sampled via newspaper advertisements and psychiatrist referrals, right? So they put advertisements in the newspapers as, hey, would you like to volunteer? And they also ask psychiatrists for their referrals, right, of patients who are willing to be part of the study. 12 weekly sessions. They used self-reports, self-observations, and a diary record of panic attacks and severity, right? So they asked participants to record their own day-to-day anxiety attacks, panic attacks. Okay, so on the CBT group, you can see the table there. Those who go for CBT sessions, they have to identify misrepresenting, or not they, the psychiatrist with them helps them to identify misrepresentations in their thinking, right? What's all this illogical thinking? No, that small little spider is not going to kill you, right? Alternative non-catastrophic interpretation. So what does non-catastrophic mean, right? So oftentimes people with phobias, when they see something that they're afraid of, they always think like the whole world is coming to an end, or they're going to die, right? They feel like they can't breathe and they're going to die. It's always a catastrophic interpretation. And that's obviously not good, right? You always think the whole world's going to end just because you see something that you're afraid of. Okay, so they try to think of alternative ways of thinking, right? Okay, no, you're not going to die. The world's not going to end tomorrow. Okay, let's wait a while. Okay, can you see? Look out the window. Is the world coming to an end? No, it's not. Okay, let's take it realistically, right? That spider is in the corner of the room. That's where it is. It's in the corner room. It's not where you are. And slowly from there, you help them, challenge evidence for their beliefs. If someone says, I'm going to die. I'm like, okay, why are you going to die? The spider's all the way over there. You're all the way over here. It's not even touching you. How exactly are you going to die? All right, so you challenge their beliefs until it clicks in their head. Hey, you're right. I'm not afraid anymore. Right, and then applied relaxation is what we looked at earlier. Progressive muscle relaxation done in panic and non-panic situations. Right, so you teach people how to relax their muscles and their body when they panic, and even when in a normal situation, so that they can know how to control it. Right. evaluate this on your own. Are self-reports good? Are self-observations a valid way of measuring things? Is it reliable? Is it biased? So on and so forth. And so on. Okay, so what were the results? The results were very positive. There was no significant difference between both the groups, right? The CBT group and the applied relaxation group. Is that a good thing or a bad thing? Think about it, right? If there's no difference, that means both the as you can see from this graph, from the pre, post, and follow-up over 1 year. So at the pre levels, it was about 4. Both of them were about 4. Post levels after treatment dropped to about 0.5 to 1, around there. And then after 1 year of follow-up, even dropped further, right, to like between 0.5 and 0, right? So that's excellent. That means even after 1 year, this treatment was effective. And that's very good for a longitudinal study that shows, right, long-term effects, which is exactly what we want. When we treat people, we want to make sure that it helps them over a long term. No relapses over 1 year, right? So they didn't have any problem with their anxiety after a year. Which is very good. It's a good thing, right? What you have to be careful of is that, I know it says no significant difference, but you have to look at the data to see whether it's no significant difference and both the groups did well, or no significant difference and both the groups did equally badly, because that can also apply. When we say there's no significant difference, it just means that the CBT group and the AR group are not different from each other in terms of their score, right? They both scored the same. But that statement alone doesn't tell us whether they were both scoring well, as in the treatment worked, or they both scored badly and the treatment didn't work, right? We don't know that until we look at the graph. So you have to look at things like a graph like this to understand, or look at the data and you're like, oh, okay, so both of them had reduced frequency of panic attacks after 1 year as well. So that's obviously very good, right? Again, please go and read the actual studies to fully understand them. Okay, that's all for the anxiety disorders chapter. Once again, my name is Ross. Feel free to follow me if you want on Instagram. Always happy to hear your positive feedback and anything that you want me to improve on. If you don't mind helping me out, please like, comment, and subscribe. This really helps build my channel because I don't charge anything for YouTube. I don't get paid to do it either, and I enjoy doing this to help students around the world. And so if you don't mind helping me out, please share this video with as many of your friends as possible. Like and comment, because that helps the YouTube algorithm recommend this video to more people. At the same time, if you feel generous and you want to donate, you're more than welcome to donate. I accept PayPal donations. I live in Malaysia, so if you're a Malaysian and you're watching this, you can contact me via email on YouTube and ask me for my bank details, and feel free to wire transfer as well. Again, this is completely optional. It's up to you. If you feel blessed to donate to me, that's more than welcome. I don't have a current full-time job at the time of filming this video, and so I get by with whatever people are willing to offer. I continue producing content thanks to you guys, and I appreciate all my previous sponsors and previous donators. Really, thank you for encouraging me and also supporting me. It's been an interesting ride, especially in the middle of a pandemic when many people are losing their jobs. I myself don't have a job right now, but we all get by one day at a time. Okay. So thank you very much, and I'll see you until the next video.